So neuroplasticity is the concept, and it's particularly centralized around the brain and the nervous system. But I'm pretty sure we've got enough evidence now in science that there's the neuroplasticity of every part of ourselves, of our body, as well as emotional self and things like that. But it's the idea of the ability to transform our brain through various things that we experience. So physiologically, so when we're, let's say, going through adolescence and about to go through puberty, or when we're pregnant, or when a woman has gone through menopause, or any of those sorts of big hormonal adjustment times, the brain literally changes. The concept of neuroplasticity is that you can change the brain no matter where you're at in life. But the idea is that there are certain physiological hallmarks that change our brain quite dramatically. And, like if we just, let's say, touch on the adolescent brain. So the adolescent brain is a prepubescent female turning into a woman, and how do all those hormones change her brain and her outlook on the world and how she sees herself and her cognitive function, her memory span, her perception of what she's experiencing. And then when we look at a pregnant woman's brain, it gets even more fascinating, because certain components and certain sections of the brain literally shrink, and certain sections of the brain expand to turn her into a mother. The sections of her brain that are surrounded about visual cues and seeing people clearly and interpreting expressions in other people expand enormously, as do her fear receptors, so that she actually is more fearful and protective of her children. And, that whole idea of people that talk about baby brain and the brain shrinking and all that sort of stuff, functionally, it's actually totally correct, but it's very much about the brain shrinking because of all of the fat going to the baby for the baby to be born, but also the shape of the brain changing, so that she ends up being more service-oriented, more caregiving, more loving, more nurturing, and more protective, of most importance. The partner, if they're male or female for that matter, but let's just assume heterosexual for the minute, the partner's brain changes as well. It's just that it's not as well researched, because we've got enough science to show that, the male body changes when their partner is pregnant, and their experience and their fluctuations are evident, but their brain changes to become more protective as well in a different way. And we can see changes in their testosterone receptors and all that sort of stuff as well. So we change. We are literally, the plasticity of our brain and the plasticity of our actual body changes for our experiences. And the idea is that we change our brain to be better parents, to be better humans. But the flip side is that all of those increase in fear receptors, increase in apprehension, anxiety, just protecting what our children may or may not be exposed to, can then transmit that information to the next generation as well. So it's a tricky spot when we're pregnant.
So the kids can pick up on potentially some anxiety or
Absolutely.
some of those protective features, and then uptake that into their own personality. Is that what you're kind of getting at there?
And we've got evidence that it's in utero exposure. So the amount of cortisol that we're exposed to in utero determines our cortisol patterning when we're adults, or just born for that matter, to be honest. So it's the idea of whatever our mum was feeling like determines who we are.
Amazing stuff.